Today, our deep dive tackles a topic every single medical professional will encounter: headaches.
Oh, definitely. All the time.
We've got clinical scenarios, patient details, management strategies, basically everything to help you navigate different headache presentations. Our mission today is really to break down these cases almost like a clinical discussion, helping you grasp the key facts and those crucial decision points quickly.
And this is great because we can really connect specific patient symptoms directly to differential diagnoses, the investigations, the management plans.
Right.
We'll be zeroing in on those critical nuggets of knowledge from each case, highlighting what truly matters when a patient walks in complaining of a headache.
Think of it as a guided tour, maybe.
Yeah, exactly. A guided tour through common and critical headache presentations you will see.
Okay then, let's unpack our first scenario. Imagine you're an FY2 foundation, year 2 doctor. You're in a GP surgery.
Okay.
Jane Hunt, a 31-year-old man, comes in. He's got a 4-week history of cough, flu, runny nose, fever, standard stuff.
Right.
But more recently, the last 4 days, he's developed headaches. Between the eyes, worse when bending forward, pain in his forehead, cheeks, and a greenish discharge from his nose.
Okay, quite specific.
He asks you, "What is wrong with me, doctor?" So what's your immediate thought there? What specific questions pop into your head?
Well, the symptoms here are pretty classic, actually. That frontal headache, the worsening pain when leaning forward.
Yeah, that's a big clue.
It is. And combined with the flu-like illness and that greenish discharge, it immediately points us towards acute sinusitis.
Okay.
To really solidify that, you definitely want to ask about any loss of smell. That's quite common, too.
Right, and examination.
On examination, you'd expect to see, well, purulent discharge from the nose, maybe some tenderness if you palpate over the maxillary sinuses.
Okay. So if the diagnosis is looking like acute sinusitis, what is that exactly, just briefly? And what's the initial management plan for Jane?
Sure. So acute sinusitis is essentially an inflammation, a swelling of the paranasal sinuses, those air-filled spaces in the face and scalp. It's really common, usually caused by either a viral infection, like a cold, or sometimes allergies.
Okay.
And the key insight here for you, for your practice, is that the vast majority of these cases are viral. And importantly, they're self-limiting.
Self-limiting.
Yeah, they clear up on their own, usually within 2 to 3 weeks.
Yeah.
So initial management is really all about symptomatic relief.
So keep it simple.
Keep it simple. Simple painkillers like paracetamol or ibuprofen. And maybe a nasal decongestant spray or drops can make a big difference for the patient's comfort.
That's a really great point about it often being self-limiting. But, what if those symptoms persist? Or if there are red flags, maybe, when do you start thinking about escalating treatment?
Good question. If symptoms drag on for more than 10 days, then we'd consider stepping things up a bit.
Okay.
The next step often involves a nasal corticosteroid. You typically prescribe that for about 14 days.
Right. Steroid spray.
Exactly. And we might also consider antibiotics at that point, something like amoxicillin or phenoxymethylpenicillin for 5 days.
And allergies. Penicillin allergies?
Ah, yes, good point. If there's a penicillin allergy, you'd switch to clarithromycin. And if you suspect allergy is the root cause rather than infection, then an antihistamine can be a useful addition.
Makes sense.
And general advice is paramount here. Adequate rest, plenty of fluids, advising them to avoid triggers like smoking if they smoke. And using a simple saltwater rinse can sometimes help too.
Yeah.
And always safety netting.
Crucial. What are the key safety netting points here?
You need to tell them the signs to watch for. Things like a severe, persistent headache that isn't getting better, any visual changes at all, or periorbital edema that's swelling around the eye.
Right.
Any of those, they need to come back immediately. No delay.
Okay. And referral. When does ENT get involved?
Yeah, for persistent or recurrent or maybe one-sided symptoms that last over 3 months despite trying medical treatment, then a referral to an ENT specialist for consideration of functional endoscopic sinus surgery, or FES, would be appropriate.
That's incredibly thorough. We really hope this deep dive helps you feel even more confident and structured in your approach to one of medicine's most common and sometimes most challenging complaints.